What is brief psychodynamic therapy? What does an interaction between a client and a therapist look like? Let's find out. Psychodynamic therapy is an evidence-based treatment that focuses on inducing behavioral alterations in patients through gaining insight into the patterns of their past adverse experiences. When treating a patient with more than one disorder, the complexity through which the clinician must navigate increases exponentially. And you'll see that as the individual in this case has one diagnosis, and then she ends up being diagnosed with a second diagnosis about halfway through therapy. Using a fictional case vignette and snippets from therapy sessions, you'll see how different techniques are used in therapy. The 5 main inclusion criteria used to determine an ideal individual or patient for brief psychodynamic therapy are limited time, limited goals, maintenance of focus, high therapist engagement, and prompt intervention. Brief psychodynamic therapy is focused on the supportive, interpretive continuum. The intervention techniques, such as interpretation, confrontation, clarification, and encouragement to elaborate, all allow the therapist to challenge a maladaptive behavior with the aim of giving patients insight into their long-lasting conflicts and issues. The supportive techniques, advice and praise, empathic validation, and affirmation can enhance a patient's access to abilities that might be blocked by underdeveloped or acute stress. For confidentiality purposes, the client in this case was named Patient C. I've decided to call her Anne. Anne was a 26-year-old woman with a past psychiatric history of generalized anxiety disorder who presented with severe anxiety, restlessness, fatigue, irritability, and thoughts of getting stuck. Anne reported that these symptoms started in high school and progressively worsened over the last 6 months. Her primary care physician, or PCP, tried numerous psychiatric medications, none of which achieved satisfactory results. So they tried all these different medications, and she was tapering off of them due to the side effects of weight gain and fatigue. The PCP eventually recommended that Anne see a therapist due to medication ineffectiveness and worsening of anxiety symptoms in the context of psychosocial stress, specifically family and relationship distress, and primarily distress with her partner, Riley. Anne's stated goal was gaining self-confidence and not relying so heavily on others for her emotional well-being. The following dialogues focus on different aspects of brief psychodynamic therapy and the tools used to facilitate the therapy.
I understand that you had a rough few weeks. Can you tell me more about that?
I can't seem to control my anxiety at all. I feel sick to my stomach all the time.
Can you think of a reason why you're feeling anxious?
Yesterday was Riley's birthday, and I'm worried that I'm not doing a good enough job.
Did Riley say something to make you think that?
No, but we have been doing so well recently, so something has to go wrong soon.
Has something happened in the past to make you feel that way?
Well, when I moved away from my parents for the first time 8 years ago, it felt good to have some independence. I thought things were going well, but my parents took it as a sign of me not loving them. I felt so sad and caught off guard. It has really stuck with me. Well, when I moved...
In Dialogue 1, the therapist used the intervention tools of clarification and encouragement to elaborate to uncover an unconscious reason why Anne felt anxious when things were going well. With this new insight into her subconscious, Anne could begin to separate the unconscious anxiety-provoking thoughts from her conscious reality.
Riley never puts away the dishes, and rather than saying something, I just do it myself. Thinking about saying something to Riley makes me so anxious that it just doesn't seem worth it to ever mention. Riley...
It seems like you avoid conflict with your boyfriend because conflict makes you feel more anxious.
Dr. Riley is my girlfriend.
Oh my goodness. I apologize. I'd like to stop the session and talk about this.
It's okay. It happens a lot. Riley is a unisex name. It's okay.
I recognize that Riley is a unisex name, and you say it happens a lot. I wonder what feelings come to the surface when I and others assume your partner is a man.
It makes me feel a little frustrated, but your apology means a lot. It makes
I hope therapy is a space where you can share how my comments make you feel. Our interactions in the room will often mirror or parallel the things you experience in the world as well. I hope
In Dialogue 2, there was a potential therapeutic rupture or a strain in the emotional bond between the therapist and patient, or Anne, which could result in deterioration of trust if not addressed. The therapist realized her subconscious bias caused this rupture and immediately paused the session to discuss the rupture. This allowed Anne to discuss the impact on her emotions, which allowed the therapist and Anne to quickly shift from rupture to repair. Please like and subscribe.
I need to have better control of my emotions. I can't lose Riley or my friends. I need to.
Why do you think you will lose them if you show your emotions? Why
My family has had anger issues in the past.
anger issues?
My mom has rage issues. So does my grandfather. He once.
That must have been very scary. It is understandable that you would want to keep those feelings buried. Do you feel anger sometimes?
Sometimes, I mean, not like break someone's arm angry. I guess I feel the angriest at my family for not accepting my sexual orientation. They are super religious. They say I can't bring Riley around if Grandma is there. They tell me that Grandma couldn't handle me being gay, and that it would be selfish if I made her go through that pain. Sometimes,
That must be so hard to hear from your family. That must
In Dialogue 3, Anne was encouraged to reveal the connection between acute worry of expressing emotions and past life experiences. The therapist provided empathetic validation to Anne's feelings and provided understanding or attempting to understand what she had experienced. There is a shift in conversation between Dialogue 3 and Dialogue 4.
sometimes I get thoughts stuck in my head, and it feels impossible to get them out. Today I am stuck on death. Honestly, I often get stuck on death. I don't want to die. I am scared of dying. It used to be much worse in college. I would stay up all night researching it for hours and hours. I wouldn't get my schoolwork done, and it really impacted my ability to function. Sometimes I get
Do you feel like doing the research was the only way to get the thoughts out? Do you feel
yes, exactly. If I didn't complete the research, then the thoughts would just keep spinning in there. It was debilitating. Yes, exactly.
Did you feel some relief when you did the research? Did you
So much relief. It was the only way I could move on through my day. So much.
That must have been a difficult time for you. Why do you think you are stuck on death again today? That must have been
Last night, I had a dream about my friend who died by suicide last year. Since I woke up this morning, I just keep thinking about death. Last night, I had a.
Do you think your fear of death is related to the fear of not being important to others? Not leaving your mark on the world? Do you think your fear
That sounds right. I rely on everyone else to make me feel important, so I can't be proud of myself. That sounds right.
That's the end of the transcript for Dialogue 4. I'm guessing the psychologist or therapist probably did a safety evaluation to ensure that Anne wasn't imminently suicidal before Anne left the office. In Dialogue 4, the therapist uncovered a possible secondary diagnosis of obsessive compulsive disorder. Anne showed a recurrent thought that was only alleviated by performing the compulsive behavior of extensively researching the recurring thought. The compulsion was time consuming and resulted in significant impairment in functioning. Once diagnosis was confirmed, Anne was started on a medication for management of OCD symptoms.
including our session today? We have 3 sessions left together. Where would you like to start today?
3 sessions left. Wow. With only a short amount of time, I guess we need to get into it. I really wanted to.
Why do you think you did that? Why do you think
3 sessions left. Wow. With only a short amount of time, I guess we need to get into it. I really want to tell you about the interaction I had with my grandma. I decided to tell Grandma that I am gay. 3 sessions left.
Why do you think you did that? Why do you
I finally feel comfortable sharing with people. I am proud of who I am and who I love. I am finished hiding it.
Wow. That is such a big change from when we started working together. Wow.
I finally have more self-confidence. I feel like I have more control over the outcome of my own life. I've realized it is too unpredictable relying on everyone else. I guess that is the internal locus of control that you always talk about. I finally have more.
May I ask how your grandma received the information?
She laughed and said, "Oh, I already know, honey. I love you no matter what." And then she told me how she dated a few women in her 20s before marrying Grandpa, but that it was so taboo back then she never felt it was an option for her. She told me she is happy that I can be myself. She laughed and said,
Incredible. It seems like you shared with her when it was the right time for you. Incredible.
I like the start to this session. It frames the number of sessions left, but also puts the ball in the client's court, or in this case in Anne's court, to prioritize what she wants to talk about. Sometimes you'll notice in therapy sessions, clients come in, and if we as therapists don't manage the session or the time effectively, we end up talking about the weather or make small talk, or the client just kind of vents about, well, life in general, and therapy or the session doesn't actually really go anywhere, or work doesn't actually happen. So I like that the therapist makes sure to effectively manage the time in this, which is a huge part of the brief psychodynamic therapy approach. In Dialogue 5, the therapist used praise and affirmation to convey approval of and provide support for Anne's actions. This approach is appropriate at the end of session or at the end of therapy to reinforce the growth that Anne has achieved, or that any client has achieved over the course of therapy. As Anne moves forward, at the beginning of therapy and over the course of some of the sessions, she stated that she was really worried about being emotionally dependent on others, or felt like she needed other people to emotionally save her. But at the end, and in this session, or in this dialogue, she stated that she was more in control of her emotions and felt more independent and less dependent of those around her. This demonstrates her improved internal locus of control. So, wrapping up the therapy, Anne was a good candidate for brief psychodynamic therapy because she met all the inclusion criteria, such as limited time, goals, maintenance of focus, and high therapist engagement and prompt intervention. While Anne reported that she was sad that therapy was ending, she felt confident enough in herself to manage as she moved on without therapy. She was active in therapy and willing to put in the effort to make the work happen, or to make the changes that she wanted to see, which is a huge part of therapy. It's going to be more successful if the client is willing to put in the work. If you want to go read this research article on your own, it's really short and really interesting. I really liked this case vignette.